So let's get underway. My name's Alan Higgins. I'm the Health Equity Network lead, and Alison Beedron is the Health Equity Network coordinator, who is today having terrible Wi-Fi problems and may well not come on to talk. So I'll do the introductions for Alison. So today's webinar is on creativity in health, which is a subject that's been close to my heart for quite a number of years. And I'm delighted that we have speakers today from the National Centre for Creative Health. And in a moment, we'll get underway with Hannah Watson, who's a research and policy manager at the National Centre. Then we'll hear from Kelly McLaughlin, who's a creative writer and community photographer in Grimsby. And then we'll be back with Alex Coulter, who's the director at the National Centre. And then by that time, we'll be opening up for questions. Do put questions as they come up to you in the chat facility, and then we'll come back to people after that. So if we're okay to go, we're going to move on with Hannah first. And Hannah, introduce yourself again if you wish, but also over to you for the slides.
Thank you very much. So hopefully you can see my slides up there.
Yep.
Yes,
yep,
excellent. Okay, great, thank you. So yes, I'm Hannah, and I'm the Research and Policy Manager at the National Centre for Creative Health. And I'm going to start off this session by introducing what we mean by creative health and telling you a bit about the Creative Health Review that we published in December with the All-Party Parliamentary Group on Arts, Health and Wellbeing, with a focus on one of our specific themes of the review, that was health inequalities. So we're really pleased to be joined by Kelly, who, among all the other things that she does, was also a really important member of our lived experience advisory panel for the review. And she's going to tell us a bit about creative health in practice, where she's based in Lincolnshire. And then finally, Alex will talk a bit about our next steps and our vision for embedding creative health into health, social care and wider systems. Oops. So I'll start with our definition of creative health, which you can see up here. So put simply, we define creative health as creative activities and approaches that are good for our health and well-being. And creative health is quite wide-ranging, so it can take place in health and social care settings. People might engage in their own homes as a hobby, experience the benefits through participatory activities in communities, or they might be linked to it through social prescribing. And we've got an ever-strengthening evidence base that tells us that engaging in arts and culture is good for our mental and physical health. And it does this through many different mechanisms, which we don't really have time to cover in detail today. But in the review, we bring together the evidence that we have for creative health in prevention, treatment, management, and recovery of specific health conditions. We discuss its use as a really effective tool in supporting people with their mental health. We describe the benefits of creative health for individual health and wellbeing across the life course, in supporting quality of life for people with long-term conditions as part of a more person-centered approach, and its application in primary, secondary and tertiary prevention. And creative health, when it's implemented as part of an upstream preventative approach to health, not only keeps individuals healthier for longer, but it also contributes to a reduction in health inequalities and a healthier and prosperous society in the long term. And that's what we'll focus on today. So in the review, we identified some key challenges facing policymakers today, and we set out how creative health can help to tackle them. And over the course of the last year, we ran a series of public roundtables on each of these themes, inviting along policymakers, researchers, practitioners, and people with lived experience of the issues raised to think about the role for creative health and develop a set of recommendations for the government. And you can watch all of these back and find the report and its recommendations on our website. I think there'll be some links as well in a second. And health inequalities was a key standalone theme, but it was also incorporated into all the other themes that we discussed in the review as well. We had a brilliant panel of commissioners who helped us to develop our recommendation. You might recognise some of the faces here. And we were also supported by our lived experience advisory panel, who really helped to inform the writing of the report and what went into those recommendations. So you might have noticed that one of those commissioners was Professor Sir Michael Marmot. He really helped us to think through the importance of creative health in addressing health inequalities. And you can see a quote from the review from him up here, alongside one of Kelly's photos, actually. Obviously, health inequalities are complex, and creative health can influence inequalities in a number of different ways. In the report, we've aligned to the Core 20+5 approach, the framework that the NHS uses to look at health inequalities. But we also think more broadly outside of healthcare about the role for creativity and culture at place and in communities to improve the environments that people live in and to mitigate some of the negative impacts of the social determinants of health, particularly in neighbourhoods experiencing high levels of deprivation. So that might include the use of creativity in schools, in the workplace, creativity, culture and heritage in planning and design of the built environment. And we know that asset-based approaches through which communities are empowered to identify and build solutions to their own health needs are essential in addressing health inequalities. And creative and cultural programmes at place or community level can help to foster the connections, cohesion and social capital that's needed for this. They can also be used to facilitate conversations with community members about their health needs and to co-produce culturally appropriate solutions. And creativity and culture can be central to regeneration and placemaking, so helping to instill the pride of place and ownership over community assets. So I'd just like to give a few examples that we had in the review about this in practice. Firstly, within the Core 20+5 framework, there's some key clinical areas that have been identified. For example, one of those is maternity. And this picture here is from Breathe Melodies for Mums, which is a group singing programme for new mothers at risk of postnatal depression. And as well as having evidence from a randomised control trial showing the effectiveness of this approach, it's also been identified as a really good way of engaging mothers from minority backgrounds who might be less likely to seek professional support for their mental health post-birth. And a similar approach has been used in Toxteth in Liverpool, where Live Music Now's Lullaby programme pairs new mothers and their families with a musician to record a personal song for their child. And in Liverpool, this was carried out in partnership with Cheshire and Merseyside Women's Health and Maternity NHS network, with a specific focus on the South Sudanese community. So the programme not only improved the health and well-being of the people that participated, but it also facilitates new links between families and healthcare services. The plus in Core 20+5 refers to those groups that are most likely to experience health inequalities. And we know that creative health can be used to improve health-related outcomes in marginalised groups. And in the review, we present evidence from studies, for example, with people experiencing homelessness, criminal justice system, care experienced young people and refugees and asylum seekers, finding that creative-based interventions can improve mental and physical health and well-being, as well as increasing feelings of agency, resilience, and sense of belonging and knowledge and skills. And you can see here from this quote from one of our roundtable participants, David, just summing up how this was life-changing for him. Creative health can also be used to build up understanding between services and communities. An example of this is the Bedlam Festival in Birmingham that runs in partnership with Solihull Mental Health Foundation Trust, providing a medium through which people can express their experiences with mental health through drama, dance, spoken word and music, with a focus on Black and ethnic minority communities who are experiencing persistent inequalities in mental health. And those approaches can also be used to then facilitate honest discussions about the barriers to access to services, and they can be used to co-design the solutions. As a public health approach, creative health can be used to raise awareness of particular health conditions, encourage changes in health behaviours, and open up conversations about issues that might be considered stigmatised or difficult to talk about. Birmingham City Council's public health team, for example, they have applied creative health in their approach to tackling the significant health inequalities faced by their diverse communities, using arts, heritage and culture to engage residents in conversations about their health. So, for example, using Jamaican cooking workshops to discuss diabetes, dance and drumming sessions to improve mental and physical health. And then the Core 20, which relates to association between health and socioeconomic deprivation. In areas experiencing high levels of deprivation and usually therefore poorer health outcomes, initiatives which increase community engagement, social cohesion and social capital can help to mitigate some of those detrimental impacts of the social determinants of health. And creative health, when it's implemented at place or community level, can help to achieve this, and it can provide people with a sense of agency, power and control over their circumstances. Creative activities can also act as a stepping stone to empower communities to tackle the issues most important to them. Might be housing, crime, antisocial behaviour. And that was the case with East Marsh United, who are a resident-led group in the East Marsh of Grimsby, statistically one of England's most deprived wards. And EMU deliver projects that create community cohesion and address inequalities through community voice and power. They're working to create socially, economically and environmentally sustainable community with programmes that include housing, education and employment. And you can see this quote here from EMU's Josie Moon, emphasising that creative activities such as creative writing, choir and drama groups have been really central in building this sense of cohesion. And Kelly's going to say a bit more about that in a couple of minutes. Creative health also used effectively at local and regional level as part of regeneration and cultural placemaking. So another case study we give in the review looks at Blyth in Northumberland, where the Heart of Blyth project has really placed culture and creativity at the centre of its town regeneration. So it uses creative approaches to engage residents in conversations about their local area and in the co-production of the regeneration programme, which includes a new cultural centre. So the residents are therefore benefiting from engaging in the creative activities, but also developing stronger links and a sense of ownership over those new cultural opportunities, which will encourage their future engagement. A really strong message that came from our roundtable on health inequalities was the importance of shifting power to communities and providing them with the resources and skills to make those changes that they wish to see. But it was recognised that the supporting infrastructure must be put in place by statutory organisations to allow such an approach to work and to be spread and scaled. So thinking about how we do that, the National Centre is a partner on a UKRI funded research programme called Mobilising Community Assets to Tackle Health Inequalities, which is led by Professor Helen Chatterjee at UCL. And this looks at how we can more effectively and sustainably embed those creative, cultural, natural and community assets into systems. It's a multi-stage research programme and it's funding projects across the UK to think about new and scalable models through which systems can connect with community assets, contributing to the creation of healthier communities and reducing inequalities. And they've just announced 12 new projects that will receive long-term funding over the next 3 years to put their ideas into practice. And all of the work in that programme also feeds into NCCH's ambition, looking at creating the conditions for creative health to be embedded into health and social care systems. Finally, then, just on some key messages and some of the recommendations we did make in the review. We know that creating healthy and sustainable places and communities, as well as a focus on prevention, is key to reducing health inequalities. Creative health is an asset-based, holistic and health-creating approach that can help us to achieve this. Tackling inequalities is going to require a whole system approach, and we think that creative health has an integral role to play here. By its nature, creative health is cross-sectoral, and in the recommendations that we make to government in the review, we call for a cross-departmental creative health strategy. So thinking about not only health in all policies, but creative health in all policies to really amplify the benefits that it can have. We've also addressed recommendations to metro mayors because it was clear during the review that at that combined authority level, those cross-cutting issues impacting health inequalities can be strategically addressed and creative health can be aligned with local priorities. And we've already got good examples of this taking place, for example, in Greater Manchester, where the combined authority level creative health strategy also aligns with recommendations to tackle health inequalities developed for the region. And we know that integrated care systems are an excellent opportunity to embed the kinds of work we've been talking about, and Alex will talk a little bit more about our work with ICSs. A lot of what we've spoken about today places empowered communities at the centre, and creativity can really foster this sense of empowerment, instilling agency, sparking relationships, building trust and providing momentum to address local issues. And whilst it was clear from our work in the review that communities are best placed to understand their needs and the solutions, they do sometimes need support from statutory services to achieve this. And in advocating for creative health to be more fully embedded into systems, we hope to develop a more equitable and sustainable infrastructure, which will allow these community-led approaches to thrive. And then finally, but really importantly, we know that creativity is good for health and well-being, and we know it can be particularly beneficial for those who are experiencing inequalities. Place-based approaches which incorporate creative health have the potential to improve health and wellbeing outcomes and reduce inequalities. However, in order not to reinforce inequality, we need to ensure that the benefits of creative health are available and accessible to everyone. And unfortunately, we know that's not always the case, and that particularly in the current climate, there are some significant challenges to achieving this. So it's really important that we can put forward the case for the value of arts, creativity and culture, and consider access to creativity as a determinant to health, and something that can really help us to achieve healthy and thriving communities. So I think that's enough from me. Thank you very much for listening. I'm going to pass over to Kelly, who, as well as being a valued member of our advisory panel on the review, also works with East Marsh United as a community organiser, photographer, creative writer. So I think I'll let her introduce herself.
Thank you, Hannah, for that. Can everyone hear me okay?
Yep.
Yeah, brilliant. That was a lovely introduction. Yes, I do have a lot on at the moment. I do seem to be covering all community aspects at the moment. My name's obviously Kelly McLaughlin. I joined East Marsh United about 4 years ago. I joined them by fate, just by moving to Grimsby, if people are not aware of that, in the northeast Lincolnshire, off the coast side of the world. I joined them by a creative writing group, and I'm going to start off my presentation with a poem, if that's okay, because that's the way I can express my feelings and my stories through poetry and creative writing, and then it will fit into what I've got to say afterwards. It's a poem about the seasons of my life. Bear with me, it's the first time I've read it for a little while, so it's an honour to share it with you all today. My winter was Scunthorpe, my roots were there, they were growing strong, they were my support and I was settled. Then the storms came. First I lost my leaves, lost my rustle, lost my voice. Then the stems snapped off before they were allowed to grow. I went into myself, defended myself against the cold. I did what I had to do. Some don't survive, some stay bare and raw, battered and dragged down by the wind and rain. But I fought on through the long dark nights, fighting for that light. Above ground, spring days were getting brighter. Beneath the surface, my roots were spreading across the miles to Grimsby, where the soil was sweeter and suited me better. My roots grew stronger, firmer, and went deeper. They anchored me into a town so like my own, but a town whose people are so different. A town that gave me a haven, gave me hope when I was all at sea. The Humber found me and brought me back to shore. Summer was my time to shine, my time to blossom, my time to bloom. The sun rose over the docks, the early clock struck to welcome me to Grimsby, to my new beginnings, my new chapter, one full of colour and life, achieving my goals. I was in full leaf. My leaves absorbed all the goodness around me. All restraints were lifted in the intense summer heat. The storms, broken branches, faded leaves were all forgotten. I settled into autumn, a cozy and calm. Outside, sycamore seeds were separating, whirling down to earth to start their new lives and a new place. And I, single and free, went spinning on new wings around Grimsby to build a strong community. Now winter is coming round again. Days are shortening, skies are greying, litter swirls, the streets and the trees are bare. But this time I'm secure, sure of who I am. In the season of darkness, I have the light inside of me. It's a part of me. And now I pass it on to help others in their darkness days and guide them through the seasons. And that's my poem, everyone. And I think it really says quite a lot really there in the details. That's my journey, by the way, from a kid. Unfortunately, I had quite a lot of trauma in my life from the age of 8 years old and onwards. And sadly, I was the one out of the 3 siblings who had to go into the care system. But a care system, what failed me at the time, left me out on the streets when I was 15 down miles away from my hometown. But I don't want to go too much into that. It's so raw, as you can tell, even to this day. Which confirms, which then going forward in time, still in Scunthorpe, I'm full of a lot of trauma, but I battled through it and I got through it on my own and ended up being a support worker for adult social care. With no qualifications, by the way. They're giving me the job because my personal experience in life. which then at the same time as Scunthorpe, I got introduced to photography. Bearing in mind at the time, going forward into my adult life, I then were dealing with a domestic violence case, which was basically stalking to threat to kill, basically. And my mind at the time wasn't in a good place. Everyone knew my troubles, judging me, and some were blaming me, unfortunately. The police wasn't listening to me. The police weren't even casing the links properly to allow this case to go on 6 years, even though I left him in the second year of my relationship. But so moving forward on a little bit there, because I'm aware of the time, still dealing with 3 years later, still dealing with DV case, and then sadly lost my mum, which then led me moving to Grimsby, where I met Emu by fate, basically. And this is where I talk from the heart here. I met Emu by fate. I didn't know where my path was meant to take me. I was all lost. I was living with my mum at the time due to the DV case. And sadly, because she died, it was over 50s property. I was left homeless. But left homeless to, oh, you're all right, Kelly. You've worked with the adult social services. You know what you're doing. You can handle yourself. So I find my way living over at Grimsby through a relation. My brother was living over there at the time. Didn't think I was going to stop in Grimsby. I will be honest with that. But thank God I did. Thank God I did, because I found my people. I really genuinely found my people. And I found a brilliant social group, what's called East Marsh United. And 4 years ago, I was very lost and very troubled. And I felt like 20 years of my hard work is I'm back to square one again. As you can hear, it's so raw. But East Marsh United took me in, empathised me, loved me, showed me that I've got a voice, showed me that I am welcomed, for starters. I've got a sense of belonging. And that was instantly, you could hear that message straight away. Due to dyslexia and mental health issues, due to PTSDs, it took me a while to settle in. I soon realised I had a writing group, and I got introduced to that straight away, instantly, because I know I've got a story to share. It's always been my dream to share my stories to help other people. I don't want people to go through what I had to go through. And this came possible. This really came possible from a writing group. It kind of, again, this is why I say it's fate. And I'm sorry if I'm running over a little bit on time. But when I was in the writing group, a year into my mum's anniversary, my ex-partner finally got caught by the police. Not because they was looking for him and found him for my case, but sadly he reoffended. But lucky enough, they linked it and got him arrested. I knew instantly I'm going to struggle with box and telling him how I'm speaking from the heart. He would have triggered me instantly. So the writing group come together, and we wrote. I wanted to write to the judge personally, to myself, because the cases weren't linked properly. There were so many complications, and my life was at risk so many times, to where I could have took my own life numerous of times, because I couldn't live with this trauma anymore. We're now 9 years into domestic violence. So I wrote a story, and that was one of the poems what the judge got to hear. And I wrote a victim's story to him as well. The judge listened to me, and that's when I realised the power of words. And then I realised that writing became a therapy, you know, and it gave me a safe place. It gave me a place where I felt I belonged, and I could feel like I could express myself properly without being judged or misunderstood because of my disabilities. With dyslexia, it was one of my challenges, what always set me out to fail, because I used to get my words wrong all the time. So East Marsh United they have a family to me now. You know, there was instantly a family within a year, but they are saving lives, people. These groups are saving physical lives. There's a massive gap of waiting for help. I mean, I've been living in Grimsby for 4 years, and I'm still waiting for the therapy help from the doctors, for the bereavement help. I'm not hearing nothing. I am banging at the doors. I am asking I need help, but a medication, put me on a pill, and that's okay, is it? No, it doesn't suit me. It's the wrong medication. I'm battling with a system all the time. But I can now get on with my life better, and I'm living a much more healthy, balanced life. I have blossomed from the moment I landed in Grimsby. Been fighting. I'm 40 now. I was going to say 39, but I turned 40 in January. I'm 40 years of age, and only just 4 years ago, I've started finally finding who I am and where I belong in the world. And creativity did that for me. Not the counselling, not all the authorities, what should have been acceptable, should have been, should have been people who looked after me. I've got the wrong words there, but I think you understand where I'm coming from. So East Marsh United, they offer pantomime, drama groups, coffee mornings. You know, it's just, this is such an important part of the community, and this is why I got involved from day one, because I thought finally someone's listening, and I've been involved with this from day one because it's so important that people get this message. And I'm going on a little bit now because I'm talking from the heart. I do apologise, but I hope I've expressed that okay enough for you. Oh, and thank you for listening. And if there's anything I missed, Hannah, just let me know.
That was fantastic, Callie. Thank you so much for that wonderful poem, but also for that very passionate story of your journey, and how creativity was such a support for you there, where perhaps the traditional health services were not able to give you that kind of support. But that was absolutely wonderful. Thank you so much for that. There are great comments in the chat, which you need to look at all of them as well.
Okay, on to that now.
People did really appreciate that. Thank you. Alex, can I just check before we go to Alex? Hannah, are you still sharing screen? Is that, or
I don't think so. Can you still see my?
Don't worry, it's fine if it is carrying on that way. Alex.
Thank you, and thank you, Kelly. That was really wonderful. You speak so brilliantly, and it's so affirming to hear the impact of creativity on your life. It's just fantastic that you share your story. It really is. It's hard to follow such a passionate and authentic voice. I will just very briefly, because I know we want to try and get to the discussion, just very quickly share with you what we're doing in the centre that is more focused on practical implementation of this work. So obviously Hannah's talked to you about the review and the evidence, and I'll just go through very, very quickly how we are approaching embedding and spreading creative health at a systems level. And this is partly also to give you access to the resources that are on our website. Could someone, Alan, tell me if you can hear me and everything's okay? Because I can't see anyone now. Okay.
I can hear you, and the slides are up as well. All good.
Great. Okay, so on our website, there's a section called Hubs, Systems and Places, and this is really where the work on integrated care systems is located. And there's a map. If you click on that map you just saw, there's a map which shows where all the projects are going on, including all of the research programs that Hannah referenced. And in fact, phase 3, which has just been announced, will soon be on this map. Here you've got a couple of pop-ups which just show you, for instance, Cornwall Council. That's a pop-up from our Creative Health Champion Network. So we have a network of champions of people in leadership roles, people who can effect strategies within their organisations. So usually people at board level in local authorities or in ICBs or whatever. And they can be part of this network to support them, because what we know, I'm sure you're aware, is there are lots of people in systems who do understand this type of approach and do want to progress it, but they're often quite isolated in their working environments. So we try and give them that support to find peers who are thinking the same way to work with. And then another programme we do is our huddles, which are focused on co-creation with people with lived experience. And there's a pop-up there about a huddle in Gloucestershire, which was an event. They're small scale, they're locally led, but that was really about changing mental health services in the Forest of Dean so that they were led by the community rather than by statutory services. And then the other programme, which you might be aware of but is good to know about, are the Creative Health Associates. So this is an Arts Council funded programme, and we have Creative Health Associates in 7 integrated care boards, 1 in each region of the NHS. They are individuals working from within the systems. We employ them, but the ICBs host them to make change happen from within. That's one of the things we've realised over the years is really critical, is having posts, what I call boundary spanning posts, and people who are inside systems are more effective in a way at enabling that systems change and looking outwards to work with communities than communities trying to bang on closed doors repeatedly. The other thing we've developed over the last 2 years is a toolkit, which was done in partnership with NHS England and 4 systems. And hopefully this will also be a useful tool for you. So you can go into the systems bit, which is structured around things like leadership, strategy, and so on. You can go into the context bit, which is structured around these big contextual issues. And there's a page on health inequalities there, how creative health can help, and lots of very small examples. So this page shows you different groups who might be affected by inequalities and how you can then go on to these bite-sized examples, which are like this. So they have a few links to organisations working in this area. So again, I hope that is a useful tool for you. There are some links there and we will share our slides. So that is me, and excellent. I will just unshare.
Thank you. That was fantastic. 3 great inputs there. Thanks very much, Hannah, for starting us off with a review of the report. Such breadth of that report and recommendations as well. Really, really good to see that. Thanks very much, Kelly, for bringing it to life with your story so well told and passionately told, and particularly great poem as well. And thanks, Alex, as well, for just reminding us the infrastructure that exists through this network, through the centre across the country to support the work. So now it's over to folks here. Who would like to start off with a comment or a question? And I was really enjoying the points that were put into the chat, people saying about what they're working on. So please, any points or questions, put your hand up. If there's no one who's quite ready to come in just yet, I'm going to go to Hugh Nelson, who is on the call from Northern Ireland, both because I have a bias towards strategy, being my background, and a bias towards Northern Ireland, being my background as well. Hugh, are you there? Are you able to talk about the arts and wellbeing strategy that you mentioned in the chat?
Yes, indeed I can. We have got an arts and wellbeing strategy, and it's probably interesting how we put it together. But just to explain, I'm from one of the healthcare trusts. There's 5 in Northern Ireland, and there would be 2 of us with the strategies in place. So it isn't necessarily universal across Northern Ireland, but we worked with the local arts care organisation to develop our strategy, and we really wanted to try and move away from the traditional arts in health that had been focused around things like fine artwork and murals and so forth in the hospital setting. We wanted to spread out into the community and sort of tackle wider issues. So we worked with Arts Care, and what we effectively did was we put a strategy together through a series of local community workshops that involved a bit of discussion around what the issues were locally and how people felt they could contribute to it. And then we would all leave the tables and go and take part in a bit of artwork. So we ended up with a nice actual piece of artwork and symbols of what we were discussing, as well as actually having the traditional written down document. And we've got this strategy in place. We launched it the week before the COVID lockdown. So we had that initially to cope with, but we're back on track now, and we're actually delivering on that strategy. I suppose the main thing for us is that shift into the community. So we've been able to link with all the 4 local councils that we have, and link with a number of community and voluntary sector groups. So what we are doing now is very much community focused, community orientated, and therefore a bit closer to where we would want to be in terms of addressing those sort of health inequalities.
That sounds fantastic. And what was the prompt to move away from the traditional approach again into the more community oriented way of developing it?
Well, I suppose it's largely because my role is around community well-being and health inequalities, and I can't do that if I'm just working in a hospital setting. And therefore, once I had the arts portfolio, then I thought, well, I'm going to have to move it out to where it's for me familiar territory, and building on a lot of the partnerships that you make out in the community with some of those sort of councils and key stakeholders in C&D. The other side of it is, I have to say, they do it terrifically well. You know, and it's a joy actually to work with them, because it's expanded the variety of what we do. Reference earlier there to sort of photography and so forth. We've got a number of digital photography classes running now. We've got a lot of actual work going on where people are able to sort of tell their story and be more creative. So it's a much more rewarding and flourishing set of activities that we're engaged in at this stage. And I would say as well that for a number of clients and groups of people that we would work with, if you take, for example, people experiencing loneliness or people with mental health issues, I find that the arts is such a terrific introduction piece for those. So if you say to somebody, you know, you want to come to a group around loneliness, it's less attractive than if you're saying, do you want to come and take part in this activity? So it's a much softer approach, and we find that suits, you know, mental health's got that stigma. A lot of people doing the digital photography are people who were in mental health recovery. They have bonded with their peers through that activity. It's a simple walking outdoors and taking photographs and with a bit of sort of support and encouragement and guidance. But it really works very well, and it's got very much a powerful impact. We can see that, but it's a softer introductory way of getting into some of those issues. I mean, we still do some of that traditional stuff in the hospital. I mean, we're focused on likes of the rural, the renal patients, and work with them to do art activities while they're on dialysis and so forth. So there's some of that going on too, but I have to say the richness is probably in the community one.
Yeah. Brilliant. That's fantastic, Hugh. Thanks for that description. Sounds like great work. Can I invite Celine, just from the comment that you made in the chat, just to tell us a bit more about the work that you're doing in that community offer as well? Go ahead.
Yeah, basically, so we're based in Wirral, but we're part of youth service in Wirral because we have a youth service still here as Creative Youth Development. So we work with 8 up to 25 age group, but effectively, as we've obviously ran across many years, because we've actually ran as a unit since 1978 using arts. It used to be called Wirral Youth Theatre, but now we're Creative Youth Development. That process has now become far more intergenerational and linked to families. So we're kind of working with the wider family group as well. So one of our projects was, we were the second unit outside London, working with the Anna Freud Centre, where we've done Kids Time project, which was looking at like drama therapy to get young people whose parents had mental health to kind of engage and realize that they were parents who had mental health rather than adults who had mental health. And it brought the conversation through. So it was a particular kind of project that we've done. And they were basing it just with drama in London, but I'm a dance practitioner, so dance came into our workload. So we had the group split, and then obviously art and graffiti came in. And what we offer really is a vast opportunity for young people, and it's all free. But again, we work with children in care, social cases, children who are involved with exploitation. The list goes on of our kind of, you know, focused tasks basically, but we do have an open unit as well. And then of course I developed an intergenerational program for over 50s. My oldest member was 92 dancing, and for that group this has become a real hub, and they ended up working on a girls project with our vulnerable girls and putting and reflecting on their own lives and how they'd been impacted and their mental health, and some of them again with their own physical health. Through the dance project, we're starting to get support on how to deal with their body, should we say, when it's not working well. And also some of them are on cancer treatment, Clapbridge. So that also was kind of supporting them, having a core group of other pensioners to talk to who felt they knew what they were going through. So it's a vast amount of different work, and I've put my email in, so you know, happy to chat to anyone about it further.
Brilliant. Thank you very much, Celine. That's fantastic. I'm going to pick up the question that's in the chat that Nina put in. I'm not going to attempt to answer it. And it's about whether there's outcomes data about the impact of arts-based activity in terms of decreasing medication. So before I come to Hannah and Alex to suggest an answer, can I invite anyone on the group who's perhaps from an academic background? I saw Yoon joined earlier from Derby, I know Simon's in academia as well, but whether that's an issue that you come across about looking at evidence around outcomes of arts-based activity in terms of medication or health. Simon, go ahead.
I mean, Hannah can probably answer this better in the sense that, I mean, there is plenty of evidence out there. I think there's like questions about whether it's the right evidence and whether it's meeting the right people in the right formats. That said, it feels like there's a kind of pressing agenda now for kind of more health economics research to understand kind of the cost benefit or cost consequences of particular approaches. So and I know that that's a kind of area that there hitherto hasn't been so much of, and that perhaps might be particularly relevant to kind of the policy context as well. But I'm sure Hannah can probably give a fuller answer on that.
Oh, thanks, Simon. That was very helpful. Hannah or Alex?
Yeah, thanks, Simon. I would. That is part of the answer that I was going to give, certainly. So I think it depends. We've got an ever strengthening evidence base around creative health, and some of that is when you're looking at a particular intervention or treating a specific health condition, we're getting stronger and stronger evidence, including things like randomized control trials with specific outcomes that can be compared to other forms of treatment. Then often with creative health, we're talking about a wider outcome set and about outcomes that are important to people and that have a broader kind of social value, which is maybe less difficult to show through that kind of hierarchy of evidence model. And we need to kind of look at different ways of gathering that evidence. And in the review, we've got a section that is actually on cost and value, which incorporates this kind of discussion about what kind of outcomes are we looking for and what kind of evidence is important and what do we know about the value that creative health can add, and how do we kind of articulate that in terms of health economics and cost and wider social value. So I think this is all kind of part of the same discussion, really. And we do make a recommendation, and it's also part of the working of the Mobilising Community Assets programme to think about what kind of evidence we need and how we bring together those different kinds of studies and outcome measures and make a full case for creative health. We do have some really good examples of where health systems are putting this into practice, and they've developed a set of outcome measures that they want to see, and they're gathering data on that over the long term, and they've got different types of creative health provider, but offering different initiatives, but gathering similar outcomes data so we can see over the long term what kind of impact that's having. That's not happening everywhere, but it is happening in some of the systems that we've been working with, and that's building a really strong case for creative health as well. So I'm not sure that's a total answer, but really interesting.
That's really helpful to get us going on. And of course, it is the world that we live in that we need to gather evidence for commissioning purposes and so on. But it's also just good to have evidence so that we know whether we're having an impact through the work that we're doing. Yoon, would you like to come in and offer us a view on this?
Yeah, hello everybody. I'm Yoon Hyans from Derby University. So yeah, within our work, we know that group singing has a clinical significant effect on long-term health conditions, for example, chronic pain, Parkinson's, and respiratory health conditions. So, but in general, it's quite difficult to do an RCT with an active comparison within creative health interventions. So that's always the problem. And, you know, blinding is another issue that it can't be really achieved with creative health interventions. Therefore, there's always limitations within sort of systematic reviews that I have done so far. Yeah, so that's what I wanted to highlight. So it's difficult, but there are some evidence there.
Yeah, thanks very much, Ewan. And I think we are stuck within the commissioning and perhaps research world on a particular model around the randomized controlled trial as being the pinnacle of the way that we gather evidence. But of course, there's many other ways that can also gather evidence and are more appropriate to something like arts and well-being. And I noted that Celine mentioned in a chat point about gathering evidence for the work that you're actually doing in practice as you go along, which may well be for your own needs or may well be as a part of a commissioning deal, I don't know. But I think gathering evidence in practice has surely got to be the way to go, and we need to value that just as much as we would value stuff from randomized controlled trial. Thank you very much, and great question, Nina, thanks for that. Would anyone else like to comment or make put a question out? Ewan, back in again?
Yeah, sorry, alongside thank you. Alongside the evidence, I think we need to also support developing practitioners' practice. So we need to develop some best practice guidelines. We need to provide ongoing support for practitioners as well. Because, you know, in traditional sense of a creative artist or practitioners training or degree programs, you don't necessarily learn to transfer your artistic practice into a health condition necessarily. So I've been looking into this topic through literature and also within our ICB, ICS as well. So I've been recognizing there is need for best practice guidelines as well.
Yeah. Thank you, Ewan. That's really helpful. I'm going to come to you, Annabelle, in a moment, just to expand on the point that you've made in the chat. But before I do so, just to say that the slides will be shared. And also, it's a bit late in the webinar, I suppose, to mention it, but yes, we are recording this, and we will kind of edit it down to the right size and then put that on the Health Equity Network as well. Annabelle from Homerton, would you like to just expand on that point you made? I can see that a number of people have responded to it.
I knew I'd regret putting something in the chat.
Go for it.
No, I was just reflecting on, so obviously we have a sort of strategic aim to work more preventatively, but with the current pressures on, you know, GPs in primary care, on wait times, on with the strikes and everything, anything that isn't immediately having an impact on people's workload is really hard to prioritize. And I think there are some things that these kind of things activities do impact on quite quickly, but also a lot of them obviously are more preventative and more have impacts later down the line. So I think for us to prioritize it, to get funding, to spend clinician time supporting these things, we really need to be able to show impacts quite immediately. And it's really hard to know how to do that, I guess, because we can, you know, before and after surveys, or we've got the simple tools, but I don't think we're very well equipped to really get good outcomes.
Yeah. Can I just ask you a bit more, Annabelle, if you don't mind, because you're working within a healthcare trust, and do you have to make the case for investment in creative health activity within that trust rather than with an external commissioner? And if you do, what's that experience like?
I guess it varies. I mean, if we're looking to do an externally funded project, obviously that's different. But within a service, say I want to redirect some clinicians' time away from doing appointments and getting through the waiting list to doing something a little bit more different. We do have the capacity to be able to do that, but we would have to be able to show that, you know, they're doing one less clinic, so they're seeing 25 less people that morning. Is it worth it for them to do something a little bit different that might have an impact later, that might reduce the waiting times, but not for another few years. Like that is a very real question that people are weighing up every day.
Excellent, thank you. Another point just to pick up from the chat that Laura has mentioned about creative practitioners need help with how to easily evaluate their projects. Can I invite anyone who is a practitioner just to comment on that, about how you evaluate your own projects? Any experience of that?
I'm happy. Sorry, it's Celine jumping in again.
Go ahead,
Sorry,
Celine.
I'm share. Basically, I mean, we obviously have like case individuals. So of course they come through from social care or from a certain particular setting angle. So of course we have a start and ground of where that young person is at. And then effectively we will build a kind of weekly case process, just building about round how they're developing and what's going on. And of course we then are involved in their kind of meetings with social workers and staff and support. So there's a wraparound process, but our end is actually making sure that that young person, the arts and what we're delivering, whatever angle that medium might be in, is actually making an impact on that young person's needs of change, whether it's mental health or physical health. And so we record that as a case study, but effectively, again, we can record it via their social health and educational growth as well. So does that then impact school? Has school seen a change in their kind of engagement or their level of confidence? Or so again, we're kind of looking at a wider process of that young person as a whole person, rather than a kind of statistic model as such. And I think that gives for people who are not understanding creative work, I think it does give a better view of what creativity does. As we just saw Kelly before speak, you know, it gives, when you see it and you read that process, you see that development. And we have social workers that come and see the young people perform who they'd never thought would perform, and that change in their life is, you know, huge. You know, there's this young person who was locked away and all of a sudden they're now singing or they're dancing or they're and engaged in a group. So I think it's about that kind of really picking out those case studies in who you're working with, and really making sure. And I think I'm just about to write it in the chat about creativity. We really do need to be teaching at that level of university, because I've lectured in a few universities doing the dance in community practice, and effectively we are missing leading on how we get our art to match policies that are out there, but also how they're actually engaging the outcome of the individual to prove that we can use creativity as a methodology. So there's a need for that, yeah. So, but I hope that helps.
It certainly does. That is really helpful. Anyone else, particularly from a practitioner perspective, would like to add to that, or any other aspect of the webinar? If there's not, then we're down to the last 2 minutes. So Alex, I was going to come back to you if you wanted to have any final word before I wrap up. You're on mute at the minute.
Thank you, Ellen. And it's been a really fascinating conversation, and lots of the themes I think coming up are ones that we are constant themes, and many of us are trying to work on, particularly this one around cost, benefit, value, proving the case, and therefore commissioning and so on. That issue is a really big challenge, and obviously the work isn't necessarily funded via commissioning routes. And one of the things that's interesting about systems that are working in a more engaged way with their communities is it unlocks a different way of thinking about funding, that brings in that actually more creative approach to how you make this work happen. But there is definitely an issue around capacity, resource and sustainability in the sector, whatever that sector is. I would call it the provider sector, if you like, that is really a challenge. It's similar to the wider voluntary community sector in many ways, and you know, within that we've got the pressures from the top down on the NHS and others and local authorities. So we're all in it together. And I think one of the things I feel very strongly about is it's the short-termism which comes from government, actually, because of their short-term cycles. That short-termism goes down into the NHS and into local authorities, and the voluntary community sector experiences the challenges of never having sustainable there aren't routes to sustainable funding. There really aren't. So I think we have to work collectively to try and shift that, and we can all play our part. And, you know, it is around collaboration and partnership working that you start to shift people's thinking. So that's just to encourage that collaborative approach wherever you are in the system. And to say, well, thank you very much for giving us the platform today, because it's great to have this audience, and I hope people have found it interesting.
I think everyone certainly has by the comments that we've got going, and good to see a connection between Kelly and Celine happening there. Excellent. Thank you very much, everyone. Adele, I saw a very interesting comment from you about compiling reports into stats. We haven't got time to go into that at the moment, but if you want to put a link into the chat, then I'm sure people could follow that up afterwards. Thank you for the comment anyway. So that's all we've got time for today. Thank you so much to Hannah, Kelly and Alex for being fantastic speakers, for being inspiring and passionate about the work that you do. And you can come back to the network next week where you'll be able to look at the video again, follow up the links as well. And then in a month's time, towards the end of March, I think it's the 28th, we'll have our next webinar looking at cold homes. And please do join that if you'd like to contribute to that and are interested in it. So thanks very much, everyone. See you again next time.